You ever listen to a doctor on a TV show and they start rattling off all this medical jargon and you feel like they're speaking a completely different language? Well, today, we're going to crack that code. We're going to break down exactly how doctors classify spinal fractures and turn all that confusing terminology into something you can actually understand.
We've all seen it, right? In the movies, on the news, first responders show up to an accident and bam, the first thing they do is put a neck brace on the patient. That's not just for dramatic effect. That one single action is the very first line of defense for the most fragile, most important part of your spine. And understanding why that is, well, that's the key to everything we're about to talk about.
So to really get why these injuries can be so serious, we've got to start with just a little bit of anatomy. It all begins with the two vertebrae at the very top of your spine. We call them C1 and C2. These two are totally unique, and the way they work together is the reason you can move your head at all.
Okay, meet C1. Its nickname is the Atlas, and just like that Greek titan who had to hold the entire world on his shoulders, this one little ring-shaped bone has the massive job of holding up your entire skull. It's basically the cradle for your head.
And sitting right below the atlas is C2, also called the axis. Now C2 has this really cool peg-like part that sticks up, called the dens. You can see how it slots perfectly inside the ring of C1, right? That little setup creates a pivot point. It's an absolutely ingenious design, and it's what lets you turn your head to shake it no.
All right, so you've got the basic anatomy down. Now let's introduce the main characters of our story today, the fractures themselves. Each one has a different name, a totally unique cause, and believe me, a very different personality when it comes to the kind of danger it represents.
First up, we have the Jefferson fracture. You can think of this as a burst of that C1 ring, the atlas. It usually happens from what doctors call an axial load. That's a force coming straight down through the top of the head. The classic and tragic example is someone diving into a shallow pool and hitting the bottom.
So when that downward force hits, the ring of the atlas doesn't collapse inward, it actually blows out to the sides, or laterally. And here is the absolutely crucial part. Because the ring expands outwards away from the spinal cord, serious neurological damage is surprisingly rare. This is why it's often considered a stable fracture.
Next on the list is the hangman's fracture. Now, despite its very grim name, this injury is actually most common in car accidents, especially when a person's chin slams into the dashboard. It's a break that goes through both sides of the C2 vertebra, the axis, and it's caused by a sudden violent whipping back of the neck, or hyperextension.
So with this fracture, the main body of C2 actually slips forward on C3, the bone right below it. But, and this is another one of those counterintuitive things, damage to the spinal cord is still pretty uncommon. Why? Because the way it breaks actually makes the spinal canal wider, giving the cord a little more breathing room. This detail is so important because it means that putting the neck in traction, trying to stretch it out, is a huge no-no. It could make the injury way, way worse.
Now we've got two fractures that sound almost the same but are polar opposites in terms of danger. The teardrop fractures. One is from flexion, think chin to chest, and the other is from extension. And here's the difference that matters. One is extremely unstable, and the other one is usually stable. Knowing which is, well, it's everything.
Before we dig into that, let's just take a quick look at what's normal. When you look at an X-ray, the small joints in the back of your neck, the facets, they should all be stacked up perfectly, one on top of the other. Radiologists have this great simple way to remember it. They call it the bun-on-bun sign, just like a perfectly made hamburger.
But with a really bad injury, that neat little stack gets completely destroyed. Those facets can slide right out of place. If one slides up and over the one below it, it gets locked in the wrong position, and that creates what they call the inverted hamburger sign, a very clear signal that the spine's normal, stable structure is gone.
And that right there brings us to the single biggest question in all of spinal trauma. It's the one question that will dictate every single decision a doctor makes from that point on. Is this spine stable or unstable? The answer to that question changes everything.
So, what does unstable even mean? Well, to put it simply, it means the injured spine has lost its structural integrity. It can no longer protect the spinal cord, even from the normal stresses and strains of just moving your body. It's compromised. So how do doctors figure this out in a systematic way? They use a really brilliant model called the dentist three-column concept. What they do is they mentally divide each vertebra into three sections, an anterior or front column, a middle column, and a posterior or back column. It's a really elegant way to map out where the damage is. And out of that concept comes this incredibly simple but powerful rule of thumb.
If the injury has damaged structures in 2 or more of those 3 columns, the spine is officially considered unstable. It's that simple. 1 column is probably okay. 2 or more, unstable.
So, let's put this all together. When we line these fractures up, you can start to see a really clear pattern. On the unstable side, you've got the really bad actors, the flexion teardrop, a bilateral or two-sided facet dislocation, but on the stable side, you have their less dangerous counterparts, like the extension teardrop and a unilateral or one-sided dislocation. It all just comes down to how many of those columns are disrupted.
And now we get to the real heart of the matter. Why are we so obsessed with this stable versus unstable idea? Because at the end of the day, this isn't about the bones. It's about what the bones are supposed to be protecting, the spinal cord.
85%. Let that number sink in. That's the percentage of patients with an unstable flexion teardrop fracture who end up with some kind of neurological damage. This isn't just some abstract risk. With unstable fractures, spinal cord injury isn't just a possibility, it's a probability.
And the absolute worst-case scenario is something called anterior cord syndrome. It's almost always caused by those dangerous flexion injuries we talked about. The result is just devastating. Immediate paralysis and a total loss of pain and temperature sensation below the injury. This right here is why stability is everything.
Now, anterior cord is the most severe, but there are other patterns of injury too. You have central cord syndrome, which weirdly affects the arms and hands more than the legs, or Brown C-cord syndrome, which causes motor loss on one side of the body and sensory loss on the other. Each of these patterns tells a very specific story about how and where the cord was damaged. So, if you only remember one thing from all of this, let it be this. The whole conversation about spinal fractures, it isn't really about broken bones. It's about geometry. It's about stability. It's all about one question. Has this injury compromised the safe space that the spinal cord needs to live and work?
And that is the real power of this language. Jefferson, Hangman's, stable, unstable. It's not just a grocery list of broken bones. It's a predictive code. By classifying an injury with this language, doctors can immediately understand the risk, predict the future, and take the right steps to protect the spinal cord from any more harm.
And really, that's what's so incredible. This system, this code, it allows doctors to find a sense of order in the absolute chaos of a traumatic event. It gives them a map. It shows them a clear path from a potentially devastating injury toward stability and hopefully toward healing. It's just a powerful reminder that truly understanding a problem is always the first and most important step to solving it.